You know, like the grass is not always greener on the other side. So like that was also something else I had to take into consideration. Hey guys, it's Noreen and thank you for making it to my channel. I want to say thank you to everyone. I appreciate every single one of you, all of you guys' support. So do you see this uninvited visitor? Disrespectful. I'm just gonna turn this way for the video. So yes, I know it's been a minute. I have not done a CDI video for you guys for a minute, but I'm here now, okay? And we're gonna catch up, and I'm gonna try my best to be consistent. Life has been lifing. I recently went on a trip. I did vlog a little bit of that, so I'm excited to share that with you guys. I did also do a try-on haul, so y'all gonna like that one. So yeah, let's get into it. So CDI stuff. So today I'm gonna answer some of the questions you guys have been asking me that I have not been able to respond to. But the other thing I want to say is that I do offer one-on-one strategy calls, consulting calls kind of. So basically if you're a remote nurse, a nurse trying to go remote, don't know where to start, what to do, you can go ahead and book a one-on-one call with me. You can ask me whatever questions you like. We'll discuss your goals. We'll see what you want to accomplish, and then we'll come up with a plan together to make sure you accomplish this goal. So yeah, you can go ahead and book that session. The link is going to be down in my bio. I also offer resume reviews where I help you fix up your resume so that you can actually land an interview, right? And so that's also something else that you can book. And then if anyone is interested in like maybe like a mock interview or something like that, we can also set something like that up, because my goal again is to just really help nurses go remote. I know it's a very scary thing. You don't know what to do. So that's why I am here for you. So just go ahead and check the link down below. So I'm going to see. So somebody asked me how many chart reviews and cases are you required to do in a day. Also, is there an algorithm you follow for diseases, conditions, example like determining if something is hypertensive urgency versus emergency, etc. So my facility requires you to do they want you to do 19 cases a day. But if you don't do 19 cases a day, it's okay. It's not like you're gonna be like, you know, like in detention or something, or timeout or something like that if you don't do 19 cases. I know they at least want you to do 10 cases. They at least want you to do all your new cases. So typically for me, I'm doing 6 to 7 new cases a day, right? So the new cases are what take me a little bit longer to do, because just the new cases, you're going through those cases and you're just trying to make sure you don't miss anything. So you're just trying to be very like sharp with those and meticulous with those. Once you get to your re-reviews and your answered queries and your recons, those you can kind of typically fly through it if there's not like a lot going on, right? And so the other thing I want to say is that when I'm doing those reviews with you guys, it seems like a very long time, but it's only because like I'm talking to you guys, right? I'm telling you guys what I'm doing, why I'm doing it. But once you get the hang of it, it's like boom, boom, boom. Like you're knocking that stuff out quick. Like, yeah, so that's another thing I wanted to point out to you guys. And then like I said, if you're disciplined, you can really knock that stuff out. But yeah, my facility they want you to do 19 cases, but I'm not gonna lie, I be doing like 16 cases. And that's me pushing it, right? I've been doing 60 cases and that's okay. And the other thing with my facility is that they want quality more than quantity, right? So if you're doing a quality job, you're doing good on your audit, which last month I actually got a 91% on my audit, so I'm very happy about that. But like if your audit's coming good, your query rates are coming good. So the thing with the queries too is that it's not like you have to have a certain amount of queries. It's just you don't need to be missing your query opportunities, right? So when they're doing the audit and they see that you're missing a lot of query opportunities, that's gonna be a red flag. But so like that's just something you just don't want to do. But like I said, it's quality over quantity. So you just want to make sure you're doing a good job. And if your reviews are low, like the number of cases you review are low, but your query rate is high and like your agree rate is high, because if you send a query and a doctor disagrees, that'll be a disagreed query rate. Versus when they agree, right? So if your disagreed rate is high, it looks like you're basically querying for no reason. So then that'll be a red flag too. So that's basically what they look at. And so yeah, it's basically quality over quantity. They want you to do 19, but as long as you do like 16, I think that's pretty decent. That's what I try to do. I give you 16 because my brain be fried. Like by a certain time, my brain is like, no, we're done. Like I'm being so honest, so for real with you guys. And so when they ask, is there an algorithm that you follow for diseases and conditions? Yes. So Penton and Tang is basically your Bible for CDI, right? And so this is also why I told you guys to emphasize that you can follow policies and procedures and guidelines and stuff like that in your resume, and then also point that out in your interview, because Penton and Tang is like I said, it's your guide, your Bible. You literally just pull it up. You can look up whatever it is you want to look up, your respiratory failures. When you open that up, it tells you signs and symptoms, diagnosis, treatment, how to diagnose it, all that stuff is there. So you have to be able to use your resources. There's a lot of resources that we actually have. So in the 3M, you have a CDI button, and that CDI button will tell you, like, for example, the hypertensive urgency versus emergency. It'll tell you. So in the 3M, which is the software that you're using while you're coding, doing your codes and stuff like that, the 3M has an actual button. They call it Jelly Beans, right? It's like a CDI button, code book button. All these resources are actually in the 3M. And when you click that CDI button, hold up, why is my lighting tripping right now? All right, that'll go. So when you click that CDI button, it will break it down for you, whatever diagnosis you're looking at. So for hypertensive urgency and emergency, it'll show you that both is systolic greater than 180, diastolic greater than 120. The only difference is with the hypertensive emergency is typically it's an organ failure that's connected to that. So like most of the times when you see these patients have intracranial pressure, increased intracranial pressure, they're bleeding, strokes, all that stuff, and then they have hypertension, more than likely that's going to be hypertensive emergency. So again, it's just about having that organ failure. And then emergency with the organ failure. If no organ failure is going to be urgency. And then typically urgency is treated with PO antihypertensives versus IV. IV antihypertensives can be treated for urgency, but it's typically going to be PO. And then for emergency, you're going to see like your nicardipine drip, nitro drips, Cleverprex, whatever they use now. So you're going to see a lot of IV medications for that. But yes, so in that 3M, you have your resources. You have that CDI button. There's also a Merck manual. Like I said, that Penton and Tang is going to be your Bible. Penton and Tang is literally like, it's just literally everything, right? And you'll go in there to see, okay, what should I go by? Like respiratory failure, acute hypoxic respiratory failure, hypercapnic respiratory failure, chronic, like all the criteria is in there. The treatment, the diagnosis, everything is in there. Especially when you're starting off as a CDI, you're going to be using Penton and Tang a lot, because that's going to guide you when it comes to creating your queries. And there's a lot of resources in Penton and Tang. They even have like query templates and things like that. You're also going to have a lot of webinars from Penton and Tang. Like we just had a webinar the other day from Penton and Tang about pressure injuries. We have like acute respiratory failure. Like Penton and Tang, like I said, is literally going to be your Bible for CDI. There's also Actis Pro. They have the same thing where you could go to that website and look that stuff up. Your facility will more than likely give you that stuff. Like my account is connected to my job, so if I didn't have my job, I wouldn't be able to access it. But yes, to answer the question is that there are resources, right, to help you get the diagnosis and make sure you're not missing anything. So that's very helpful. Another question that I got was, how do the doctors respond to the queries? If you get a response that's kind of spicy, how do you deal with that? So I actually had this situation recently. So basically, when you're sending the query, think of it like it's kind of like, I want to say like secure chat, like you're kind of sending, it's like a message / email, but it's in your, it's in Epic, right? Like, so my Epic is not the same Epic as it is as a bedside RN. My setup is a little bit different. I'll go through the chart the same, but when you initially log into Epic, you're literally clicking CDI review, right? Because it's just going to give you different things that you can do. And so that's where you're going to get your query placed at. And so you're going to click your query, and then they have like templates already in there. So you'll pick and choose what template to use. Like, for example, if one doctor is saying acute respiratory failure, another one is saying post-operative pulmonary insufficiency, you would do conflicting documentation, right? Because one doctor's saying this, another doctor's saying that. And but if they didn't say anything and you're just trying to capture this brand new diagnosis, it would be like respiratory status. Respiratory status would be the template that you use. So my facility has all the templates. I'm sure whatever facility you go to would have the templates as well. So you just have to learn which one to use, which not to use, and all that stuff. And so you basically draft up your query. I draft up my query in my Word document where all my notes are, and then I'll just copy and paste it and send it to the doctor. And I try to send it to more than one doctor, like the day shift and night shift doctor, so that somebody can respond to it a little bit quicker. So yeah, you send that to them and then they'll respond. So basically what happened was, I think the doctor said obesity, and I was trying to specify what kind of obesity, because there's obesity class 1, 2, 3, and you want to specify, like, that's a big thing. The obesity and malnutrition is a big thing, like, it's crazy. And so I sent it to this doctor trying to capture like obesity class 1 or 2, something like that, and the doctor didn't want to answer the query. The doctor was like, I documented obesity, send it to the other doctor, like the initial doctor or whatever. And then I responded to that doctor like, yeah, you documented obesity, that's why I sent you the query, and I'm trying to capture the specificity of the obesity, okay? And then like I was like, please answer this query. And so they'll pick and choose what they want to answer. Sometimes they'll go back and forth. So that doctor actually went back and forth with her for a while, like yeah. That's like one thing I don't like. So you'll kind of go back and forth with, not go back and forth with them, but I mean, you will go back and forth, but I don't want to make it sound bad, right? So, but it's not as bad as it sounds. Like, it is what it is. And so how my facility have it is that there's a doctor that basically works with CDI and then works with the physicians and basically tell them the importance of CDI, like how we capture these diagnoses. We need clarification, or the hospital is going to have to deal with denials, and denials are a big thing, and we're there to prevent that. So there's a doctor. So basically when a physician's giving me a hard time, because that doctor also gave me another difficult situation where I want to say it was something with the malnutrition or something like that. I was trying to capture malnutrition and she didn't want to like answer. She wanted me to send it to another doctor, and it's like, dude, you're the current doctor and you did the discharge summary. Like, they're supposed to do that. And the thing is, the intensivist and the internal medicine doctor, the attending physician, is the one who drives the boat. So when these consults come in, like nephrocardiology come in, they give you a diagnosis and it's questionable, or you want to validate it or make sure it's legit, you have to send it to the attending or the intensivist to get the final answer. And sometimes they don't want to answer. Sometimes, no, I'm not gonna lie, most of the time they're really, really good, but sometimes we get these doctors that like a little resistant. And so you just have to tell them, like, I'm saying this because I need clarification, so I need you to answer this. And I also had that situation, I think, with the neuro doctor. They're like, refer to my note. And I'm like, your note is not clear. Like, answer my query, right? And it's like, at the same time, it's like, we're not there to fight with the doctors. We're there for clarification. Like, that's what it is at the end of the day. We are there to get the accurate documentation, like the accurate diagnosis. If anything is finicky, if it's finicky to us, it's going to be finicky to those reimbursement people. And we're trying to avoid denials. So it's just like, you just have to be respectful. Like, hey, doctor, thank you for your response. I just need to send this query to get clarification, yada yada yada. And so when they give you a hard time, like, I'll basically save all of my patients that the doctor gave me a hard time from the query, and I'll send it to my manager, because that's what we're supposed to do. I send it to my manager and tell her, like, hey, I'm having some issues with this doctor, and then she's gonna escalate it to the doctor that's over them, and that doctor will talk to them. And we even have meetings with that doctor that's above them. Like, he tells us what to capture, what to look for, what to query for, things like that. So like, he's on it. And then any doctors that are resistant, you just basically escalate it and then they'll take care of it. And but the thing is, like, with some of these doctors, they're just known to not like really be compliant. So you just got to do the best that you can. So that's basically how you would deal with those doctors. Like, I remember one time, the same thing, like I said, with the post-op pulmonary insufficiency, like post-op respiratory insufficiency, the acute post-op respiratory failure. That's a common one. Like, the pulmonologist will say this, but the intensivist will say this. So you have to send a conflicting documentation query to clarify, like, what is it, right? Like, you just have to. And one doctor was like, post-op respiratory insufficiency is the same as pulmonary insufficiency, and it's just like, no, it's not. It's a completely different code. Post-op pulmonary insufficiency is an MCC. Post-op respiratory insufficiency is not. So you just kind of have to basically send them like a message, like, because when you send them the query, they're supposed to respond a certain way. If they don't want to answer it, they'll just be like, oh, decline the query, or not my patient, or whatever, or they'll put the reason why they don't want to respond to it. So then you have to say, hey, thank you for your response. I appreciate you, doctor, blah, blah, blah. But I need to do this, blah, blah, blah. This is my job. I need you to answer this query. So that's basically how you will deal with those doctors that ask that gives you the spicy questions. That was really funny that she asked that. Okay, so somebody asked me, do you clock in and out? At my facility, at full time, you do not clock in and out. And that's actually one of the things that I absolutely love, because that was just not my thing. Clocking in and out on time was just not my thing. I'm just good at showing up and starting work. So my facility, you don't have to do that. Typically, I feel like most full-time jobs, you don't have to clock in and out. It's not constant engagement, but your manager should be able to reach you at any time if necessary. Like, my manager will call me randomly, not randomly, but like, she'll call me when she need to call me. She need to ask me a question, especially like when it comes to like PTO and things like that. So you just have to be readily available. Sometimes somebody will Zoom you if they need anything, but it's not like you have to constantly engage with people on throughout the day. And so as far as the scheduling goes, so my facility, you can start anywhere from 6 a.m. to 9 a.m. So as long as you start before that, that's all that matters. And then you just have to finish your cases. Whatever's been assigned to you that day, your numbers have to make sense. If you want to stop at 10 o'clock, if you want to start at 6 o'clock, stop at 10 o'clock, go do what you have to do, and then come back and finish in the evening. Like, you can do that. You just have to make sure you're starting on time and you're doing what you need to do before the day is over. Like, everything is done. Somebody asked me, can you work while you are traveling? So my facility said you're supposed to ask permission. Like, you know, I live in Texas. I'm from Florida. So sometimes I go home to Florida. And so my manager would just want me to let her know that I'm going to Florida. So yes, you can travel within the States. However, you cannot go outside of the States, because actually, my best friend tried to go to Mexico. She went to Mexico on a trip, and then she tried to work. We work for the same facility, and the VPN wasn't working. It did not work outside the country, so she had to like go through a whole thing and say how she had to go there emergently and all that stuff. So out the country, no, but within the States, yes, it'll work. You would take your brain with you. You'd have your docking station, your laptop. You'll take that with you, and you'll be able to connect as long as you have Wi-Fi. So yes, I just wanted to catch you guys up. I also want to tell you guys how I had so I definitely want to say that once you get your experience, it definitely does get better, because I've had recruiters hit me up on Indeed trying to offer me CDI positions, but it's just not something I'm really interested right now, as I am a psych NP, so I'm transitioning. So yeah, I just want to talk about how it does get easier like once you've been doing the job for a while, because like back in January, it's March now, back in January I applied to this position for another hospital near me. Let's a CDI remote role, and then they actually reached out to me in like maybe February, and they wanted to like schedule an interview and everything. And so I'm not even gonna lie, I'm gonna tell you guys what happened. I'm gonna be honest. So I applied for that position, then they called me. I was like, who is this? Then they left a voicemail like saying, oh, we want to like schedule an interview. And I was just like, I was a little bit iffy, because I'm a new psych NP. Like, first of all, one CDI job is a lot for me. Just my brain, my attention span, one is enough. So what am I going to do with two realistically? And so like I was just very hesitant on it. And then they had called again. And I was just trying to decide what I wanted to do. They called again, left a voicemail. And then, so I was just going to like, I'm not going to lie, I was going to call my mom and see what I should do, because that's what I do. Then I saw they just scheduled me for an interview, and I was just like, oh my gosh, what? How are you just gonna schedule me for an interview? And I don't know, I just thought about it and I just felt like I just did not want to go through with it because one, I have a job already, a CDI job. When I applied to that job, I think I was waiting on my Psych and P job, to my Psych and P license for Texas. So I didn't really know what was going to happen, but then I ended up getting my Psych and P license, and then I got called for that job. So I was like, I don't really want it because I didn't want to do the whole onboarding thing. I mean, I'm sure I could have, but I didn't want to do like a whole onboarding thing and then I gotta like quit a job, then quit that job to start a new job. Like, it just would have been too much. And then part of me was like thinking I should have at least went to the interview to like hear about the pay and all that stuff, but even that was stressing me out. Like, I was like, I don't want to do that, like, no. And then I just really didn't want to start something and then have to like quit, like, you know, after these people invested in me. So that was something I didn't want to do, and I was like, let me give somebody who actually wants to get into CDI position, you know. So that's something that happened. But I am curious about that pay. I wish I could have found that out. I don't know, but maybe I should have took that job because finding a Psych and P job is a lot of work. But and then it was like, for me too, my job is like so flexible. I'm gonna say flexible, but it's like I can work at my own pace. It's nobody really stressing me out, and I'm really grateful and appreciative of that. And you know, like, the grass is not always greener on the other side, so like that was also something else I had to take into consideration. But yeah, I just wanted to share that with you guys to let you guys know about my little experience there. So I hope you guys found this video helpful. I will be updating you guys. I will be doing more chart reviews because I see you guys really enjoyed those. I also want to do reconciliations with you guys and just kind of go over important words and things to know for CDI. So yeah, I'm going to work on all of that this week. I appreciate you guys so much. Thank you guys for watching. Don't forget, I do offer one-on-one consultations. If you guys have any questions, you can go ahead and book a consultation so we can get you a personalized plan. I also offer resume reviews. The link will also be down in the description. And then I have many resources. Like, I have free resources you can purchase to help you with your CDI journey, to help you nail your interview. I have a practice pack if you want to practice doing a case review. Like, I have so many resources that I wish I had when I started CDI. So I really hope you guys take the advantage and utilize these resources. Thank you guys for watching. Let me know if you guys have any questions. Thank you.